Hey everyone, Dr. Todd Higginbotham here. It's been a crazy day. I know we visited last week about some different things about offices opening and when they're going to open in phases. So today we actually opened because Arkansas had moved the date up. So I have been out today visiting offices, making sure everyone feels good, feels safe, that patients, especially employees, just to make sure we have everything we need. We've been preparing for this for, 2 weeks now. So we've been ordering, have plenty of things, plenty of PPE, plenty of masks, jackets, and so that's what we've been doing all day, is making sure everybody feels good and comfortable and questions were answered, and all the training videos that we did beforehand are coming together now. So that's what we've been doing most of the day as we start seeing patients. When will it be our normal again? We don't know. Arkansas has phase 1, phase 2, phase 3. Phase 1 is going to be, we can do most procedures, including immediate implants. Now, can we do a full cosmetic case on you? No. Can we do a full implant case on you? No, they don't want us to do that right now. So it's going to be a reduction in patients, maybe about 50%. That includes hygiene as well. And what we'll do is, as we see those folks and as the state seems things get better, we'll enter phase 2, where basically it's the same as phase 1, but we just start seeing a few more people. And then phase 3 would be where basically we just start opening up more procedures, more things, more back to normal at phase 3. In Tennessee and Missouri, it's a little bit different. Arkansas has its own set of guidelines. We're following Arkansas's guidelines to the T as they want us to, but in those other states around us, they have ADA guidelines and OSHA guidelines, which we follow everywhere anyway. But we're following those more in those states because we don't have quite the restrictions that Arkansas has placed on us. So if you're calling in, if you need some if you have periodontal disease and you need some gum treatments, we're doing those. In Arkansas, we'll do those, but we'll do more hand instruments. And as we move into Tennessee, we'll be using more ultrasonics as we hold the suction against it. So it's going to be a little bit different, and especially as the states, because we have to follow their exact guidelines. And so like I said, a little bit different across state lines. So, but today was great. We're starting to see folks. It was a much lighter schedule, much slower as we kind of get back into things and move forward. So I wanted to be on today to answer questions, talk to you, anything that worries you. That's what I'm here for, to tell you what we're doing to work on it.
So Dr. Higginbotham, you said we can't do big treatment implant cases, but can someone still come and get a single implant that maybe has already been treatment planned?
Well, in Arkansas, so in Tennessee, I don't think that's going to be a problem. In Missouri, I don't think that's going to be a problem. In Arkansas, what they have told us is if say we have to pull a tooth and an immediate implant needs to be placed, they don't have a problem with that. But I think if it's just an implant, the way I read the directives is they really don't want us to place just a single implant just yet. They want us to wait a bit for that. So more of an immediate yes, but if it's just a spot that's already there and that we need to put an implant in, that they want us to hold off on that for the moment.
Some patients that are scheduled want to know, since we're wearing extra PPE, do they need to come in wearing a mask or anything extra?
So it's been, and on the Arkansas side especially, it's been a directive. So if you come into our office, we're going to offer you a mask if you don't have one. And so throughout the system, most people are coming in the office with a mask on. We will have one for you if you don't have one. So basically you would have a mask, you would come in, you go to the back, you take it off, we do our work, you have one to leave. So we have those for you if you need it. And most time we'll be offering that. So.
Dr. Higginbotham, you don't work at every location, so if you don't mind, for those that haven't met you, could you kind of let them know what locations you're at? Some of the patients, for instance, Miss Kathy goes to our Kennett location, but she said she didn't know who you were. So maybe just kind of let them know. So
I have so Tuesdays and Thursdays are my days that never change. Okay, so on Tuesday I'm always at our Hilltop office in Jonesboro. Thursday, I'm always at my Southwest Drive in Jonesboro. Now, the other days through the week, they kind of change here and there. So, I have different days, I go different places, and to do certain procedures as well. And so, those 2 days I know of. So, Tuesdays and Thursdays don't really change. Mondays, I kind of move around some. Wednesdays, I kind of move around some. So it's just those 2 days I know for sure.
Some patients wanted you to maybe talk a little bit about our new East Memphis location and Dr. Gersuckle, who's going to be the doctor they're going to be seeing there.
So right before all this started, we bought Dr. Joe Rutledge practice in East Memphis, for those who don't know. And so we're excited about it. We didn't get to do what we usually do with offices like that because we've sent out emails and letters to patients, but it's hard to know what's going on when you don't get to see your people. So Dr. Gersuckle is going to be there. She is from Memphis. She's been a dentist for about 5 years. She's great. She's a wonderful doctor. Dr. Rutledge is actually going to move. He's going to Arizona and has a practice going to start there. But she's going to be there. All the same staff will be there. The front desk, the back, the hygienist. Everybody's going to be there that you'll see. You'll know. I mean, could there be some changes? Sure. I mean, that's what we do. I mean, we go in and we try to make everything as best we can for the patient and our employees. And so will there be some changes? Sure, there'll be some changes. But we try to explain it along the way. And if you have issues, problems, come to us. I mean, we're trying to make everything, like I said, better for everyone. And so, but we're excited about it. We're excited that she's there. We're excited that the staff is all going to be with us. And just look forward to trying to improve things in our presence in East Memphis. So.
Janet wanted to know if there was a chance you would be back in Bartlett, and maybe the best way for her to find out.
Okay. So, yes, because I'm trying to set days aside that I go to Memphis and do work. So, yes, but I don't, when is that? I don't know. The schedules are so all over the place right now because we're just getting back to work. And so, like today, I did not see people today because I wanted to go to each location myself and speak to people, not patients, but not only in our employees as well, to make sure that, you know, they have everything they need, that they feel good about what we're doing. And so I wanted to make sure and do that today. So some days I'll do that if I feel like I need to go just to look around and make sure everything's running the way that we want it to run. So I don't know that yet, but yes, I plan on that, but I don't have that day yet.
And they can call the office, and that they'll know eventually.
Yeah, as we start building schedules, they'll know when I'm going to be there because I'll build the schedules a month out. But since everything just opened up just now, well, we just kind of put everything in place, and then now we'll start focusing on June.
So now that we're back open, hygiene schedules have been really full, and people are wanting to know what they can do to get in, especially if they missed their appointment during March and April. And so what's the best way for them to get a hold of us?
So for us, I mean, it's definitely put us behind because, I mean, we had all these appointments and we had all these people that we need to see, and then in the middle of treatment, and then all of a sudden everything shut down for 2 months. And so now we're kind of picking up where we left off. I mean, texting, emailing is always the best because it's just really efficient for everybody. I mean, if you need to call, it's no problem. I mean, we're here for you. We're here to talk to you, and we want to. But there's going to be a lot coming in, and especially in Arkansas with the schedules being a little slower than usual. That's going to slow down things. So just be patient with us. We're trying just like you are. We want to get you back in. We want to clean you. We want to fix you. But we just have some mandates, especially in Arkansas, that we have to work through to get you fixed. So.
And patients want to feel like it's, and want to know, is it safe to come to the dental office? Yes, they opened us up, but what are we doing to make sure that, to ensure that they're safe? And
I think through all this, and even Dr. Smith here in Arkansas mentioned that we have to get our confidence back in our systems, whether it be a physician's office or a dental office or a chiropractor or anything. We have to get our confidence back in those places to get back to business as usual. I mean, he was talking about where his in-laws had actually went to their physician today just for a checkup appointment. And I think it's important for all of us to think about it that way. I mean, like I said, he even mentioned it. I mean, we have to get the confidence back in that. I mean, we have a set of guidelines that we follow. I mean, we have the jackets, we have the N95 mask, and we actually put another mask over the top of that mask. We have our goggles, coverings for head, anything you can imagine we have for PPE, we have it. When you come in as a patient, you will come in, we'll check your temperature outside, we'll have some questions for you, you'll sign a consent form, you'll come in, the front desk girls will bring you to the back, You'll come in, you'll wash your hands immediately. You'll rinse your mouth out with something that kills bacteria immediately. Then you'll sit down and we do our work. And then when you get done, you'll wash your hands again. Someone from the front will pick you up, take you back out. And so pretty minimal trips to the front and the back. And so once you do that, then you're on the rest of your day. I mean, we are used to following universal precautions in dentistry. And so it was one of those deals where they talked about all the things we needed to do. Well, we were already doing 99% of them already. So in my opinion, I would never be worried about the dentist in the sense of we don't have the things we need, or we're not wearing the things, or, I mean, there has been arguments that the aerosol could, but I haven't seen any data that says that for sure, but there's been suggested, and I think that's why they're taking so many precautions with dentistry, but we don't know that for sure. I mean, there's a lot of things we don't know. There's a lot of question marks, you know. We're gonna suit up and get ready, just like worst case scenario. But that's what we do anyway as dentists. I mean, we always do that anyway.
That's all the questions that I have from our patients. So I hope that this was informative. And is there anything else that you want to let our patients or future patients know?
Well, one thing I will add, and you'll see it at all of our offices, we're putting it up, it's just a piece of paper. I noticed restaurants are doing this as well. With the spot that we're in, just like with restaurants, we have to wear so much more with the mask and like I said, the jackets we're already doing, but with the mask and the different PPE that we have to wear, that you'll notice that some insurance companies are paid for it, some are not, but there'll be like a small fee that's for PPE, and we're always transparent, and you'll see that up front, that we're doing to kind of go through this situation, because we're having to purchase so many things and do so much to make sure that not only we're safe, but you're safe. Until we get through this first bit, you'll see that letter up there, and you'll see it. We didn't do it when you're getting your cleanings. We just said, no, we're not going to do that. But if you see the doctor and then the work we have to do, you'll see that small fee on there. It's just temporary. It's just for a little while. But right now, we just needed to do that because we had so much burden on that side. So I just wanted everybody to know that, because and you'll see that as you walk in. But I told her earlier, I enjoy sitting here answering questions. I enjoy talking to you. And we're going to start doing it probably about once a week, so we can just talk kind of almost like a fireside chat, I would say, about dentistry. And I look forward to it. So, shoot your questions in or ask them while I'm on here. I'm good. I mean, anything you want to know, I'll do my best to answer it. If I don't know, I'll tell you I don't know. So we will see you next time.